FACS is the most inclusive group that I've ever heard of that teaches about this kind of planning.
FACS is the only medical organization that's actively working to educate all members of the healthcare community about all evidence-based methods.
This is the future of women's healthcare, so get on board. We need this information, we need your support, and the time is now.
The definition of insanity is doing the same thing over and over again, expecting a different result. Doing what we've been doing in this country for reproductive medicine hasn't exactly worked. So maybe there's a different approach, and the different approach is teaching people about their fertility, empowering them to make good, healthy decisions.
Investing in FACS gets the word out about healthy reproductive systems, treating underlying causes in a better way so that we can have impacts on generations to come.
Fertility awareness-based methods weren't taught at all in my school. I really do feel like there's a gap out there between what is being taught and what is potentially available for women in terms of family planning.
This is really where it starts and what it is and where we need to go in the future, because birth control isn't the answer.
Currently, most healthcare professionals don't get this as a part of their core curriculum.
If we can reach out to the students before they get this bias, it's what's going to make medicine change, because it's going to help us identify the root causes of what's going on rather than treating it with a Band-Aid approach.
You know, we got to meet people where they are, and not everybody is coming from faith, whether that be a Christian faith or a Jewish faith, or, you know, if they're Protestant, they're Catholic. But FACS is doing an awesome job at bringing all of us together, regardless of our differences. Like, women are women, they work the same, it doesn't matter. I think if we can keep that common thread, then great things can come from that.
I think if FACS did not exist, many medical students would not understand these methods. They would not offer them to patients. Patients would still be struggling to find family planning methods that had no side effects, to find family planning methods that really empowered them to care for their health.
There's a lot of people that can benefit from this.
FACS is able to present the medical science and the patient outcomes. It's attractive, both to patients and to medical providers.
At FACS, we're different because our mission is to educate all students, medical students, nursing students, regardless of their beliefs or their future career aspirations. We want them to all understand the importance of fertility awareness-based methods. Our goal is to educate medical students at the earliest stages of their career. We want them to understand that there is a better way.
The world has changed since the 1960s. There's some good science to support, and we have a new cohort of young women and young men who have a different attitude and would be very interested in the option if it was offered to them. So I think the philanthropic community has a role to play as this goes from outside the mainstream to part of the mainstream.
We are critical. Physicians really are the linchpin, and at this point, only 3 to 6% of physicians are familiar and knowledgeable with FABMs based on research done in 2013. 3 to 6%. What if that number was 30 to 60%? At FACS, our goal is to get to 80 to 90%. But we can't do that without your support. But without doctors being knowledgeable about fertility awareness-based methods, their patients may never know, and they may never have the opportunity to truly understand and be empowered to care for their health.